If you're looking for hope and optimism, vaccination hubs seem to be the only places that have that right now. At this centre, one of 10 that have opened in England today, feelings of relief and joy radiate from those getting their first dose.
I don't believe this. The last time we were coming up here was last March to a rugby match, and now I'm coming up here for vaccination.
Good. Can't wait for the next one. Yeah, can't wait for the next one.
For this couple, even the thought of seeing younger members of their family is emotional.
It means a heck of a lot. You'd be crying her eyes out the whole time.
Vaccine rollout is going relatively well. The latest figure for the number of people given their first jab is over 4 million. Now those who are over 70 and others who are clinically very vulnerable are being invited for their vaccinations, with the hope that people in the first 4 priority groups will have had their initial dose by the 15th of February. But there are issues, which have even been highlighted by a cabinet minister. The Work and Pension Secretary saying the oldest in her constituency have not been invited in, while some over 70s have. The vaccine minister this morning trying to reassure those who haven't yet.
For those over 80s who haven't had the contact, the letter yet, you will be the priority, you will remain the priority, and you will get that letter and that contact.
In Wales, the First Minister has been accused of a go-slow vaccination strategy, following criticism that fewer people are getting their jabs compared to other home nations. Mark Drakeford said one of the reasons why more supply hadn't been used is to prevent vaccinators standing around with nothing to do. But people in vulnerable groups in Wales will be keen to know when their turn will be. Over at what's normally London's second busiest airport, a new COVID border strategy comes into play. For the very few passengers that are arriving here at Gatwick, as well as any other UK port, you have to show a negative COVID test within 72 hours of getting here and then self-isolate for 10 days. But there's criticism about whether that is enough, with countries like Australia and New Zealand doing managed isolation. So that's as soon as you arrive, you will have to go to a hotel where health authorities check up on you. So is the UK doing enough? What's the difference between supported isolation and doing it by yourself?
Well, we know from our data that people are not staying at home for the period, partly for practical reasons and partly for motivational reasons. So support can help ensure people have food, medicines, internet or other resources to keep them occupied, and also ensure that they are at home by checking in on them.
Back at the vaccination centres, the news is brighter than ever, with the target of every adult being offered their first jab by September seemingly in sight. But the challenge is, in the short term, life is unchanged. Lockdown is still here, and the Health Secretary in the last few hours warning, don't blow it now.
And you can hear more from Aisha on the vaccine rollout and vaccine scepticism, which the World Health Organization says is one of the biggest threats to global health. On our new podcast, The Forecast, go to our website at the address on the screen now or search for The Forecast on all good podcast apps. Joining us now is Dr. Shandipon Laha. He's an intensive care consultant at a hospital in the northwest of England and Honorary Secretary of the Intensive Care Society, a professional body for the UK's intensive care staff. And Dr. Laha, I'm wondering why, given that there is a slight fall in the number of people who seem to be getting the virus, why intensive care is, if anything, getting more and more, under pressure. What's happening?
Well, there's a delay between catching the disease or being diagnosed with the disease and the time you need to go to hospital. Normally, about a week to 2 weeks afterwards, we start seeing admissions into the hospital. And maybe a couple of days after that when they need admissions to intensive care. So this is what normally happens. There's normally a 1 to 2 week delay. The concern is that while it might be levelling out in the community, the hospital admissions will continue to rise, the intensive care admissions will continue to rise, and our turnaround isn't as quick. These patients, instead of staying for a few days, which is a normal standard for most patients, are staying for weeks, and in some cases months. And that causes a pressure on the system that will be a challenge if we don't address it.
Can we just understand what the sort of regime that intensive care doctors in particular are working? I mean, have you got to the point where you're having to work days that would always have been days off? Are you now really working non-stop and in desperate need of R&R, as it were?
I think that all the extra days that we can do, we're doing. Most of us are working 2 or 3 days over our normal job plans to be able to achieve what we need to do. We've got, most units will have extra staff on the 24-hour period. The nursing staff are equally pressurised, as are many of the allied health professionals and the other wards that are dealing with COVID. So there's no real let-up. We've been doing this for about 11 months now, and so the continued stress is a real challenge.
When you look into the future, I mean, we're now talking about still a matter of months before this thing is remotely under control. How does it look to you in terms of an intensive care doctor, and what's going to be expected of you in the weeks and months to come?
There's a real concern that after so many months that we can't see it settling for at least a few months, and even then there's a chance that we will have recurrent surges throughout the year and next year and maybe years to come. And that's in the back of it. But once this has started settling down, we've then got to look at getting all those patients that needed operations that have been delayed and getting them through the door and getting them operated on safely. Now, that's a real problem when, especially for areas like the Northwest, and you mentioned Yorkshire, those hospitals have never been back down to their normal baseline intensive care unit footprint for 10 months. It's a real challenge. How we are going to deal with putting that pressure back on staff for, maybe another 6 months afterwards is going to be a real challenge for all of us.
Briefly, for example, are there intensive care doctors in the Army, for example, or the Air Force, who could be brought in, to help you?
As I understand it, the only way of maintaining their skills normally is to be seconded to a hospital during peacetime. So most of them are already working within the hospitals. So they aren't an additional bunch that are somewhere else that they're going to bring over. I suspect they're the same people we already work with. So I'm not quite sure that at a doctor's level, that's a particularly helpful mission.